Hi, I'm Jen, patient educator here at PA Green Wellness, answering my most common questions. Should I get a P shot? My opinion is no. I don't think P shot is the best option any longer. Last year or prior years, probably it was the best option. P shot, also called PRP, also called platelet treatment, is when the patient's blood is withdrawn, spun, platelets are removed, condensed, and injected into a very specific area of the body. As far as erectile functioning, it's obviously it would be in the erectile tissues, about 5 or 6 different locations along the penis that the platelets are injected. And the reason I say no as far as that being a good option is because there are much better options now, and this is recent. The limitation of platelet injection is those platelets are as old as you are. So if you're getting a platelet injection and you're under 30, it's probably not going to be an issue. You'll probably have a good response. Most of our patients are not under 30. And so if you're coming in and you want a platelet injection or a P shot in conjunction with your GainsWave protocol treatment, up until this year, that's really been the best option, but no longer. Those platelets are not just the same age as you, but if you're not well and you don't even know it, you could have a low-grade infection somewhere in your body, they're not as effective. You also need more of them. And I think the preference for platelet injection is because people like the idea of their own body product being injected in them. They feel like it's safer. And it's an easy thing for your physician to do. He doesn't have to inventory anything. It's really just your own product being condensed and re-injected into one area. I prefer the mesenchymal stem cell. We offer that now. All our product comes from Predictive Biotech. It's an FDA lab, and there's no stem cells, I'd like to say, in a PRP shot. So patients have an ability to inject themselves with something entirely more effective, not even on the same comparison level. We prefer that if a patient is asking and seeking an injection therapy, that we don't even look at the P shot anymore. So mesenchymal stem cells are derived from the Wharton's jelly area of stored umbilical cords from live healthy births in the United States. These are done in FDA labs, and as I said, we use Predictive Biotech. They're the leading lab in the country, processing 60 to 90%, somewhere in there, window of this human cell tissue product. I prefer human cell tissue product as a word because we also use amniocyte, which is growth factors that come from amniotic fluid. Now, amniocyte is kind of like a fertilizer, so it doesn't have stem cells in it. And when I have a patient who's very attached to the concept of a P shot or that price range, they're still much better off with an amniocyte injection. It's the same price range, but this is material that also does not have stem cells, just like your own platelets, but is less than a day old. So it's signaling, it's strong, it's healthy, it's measured, it's clean, and it is already an entirely better option.